And we begin tonight at 6 with new information after a 2 News investigation uncovered hundreds of private medical documents in a very public dumpster.
There was enough information there to steal someone's identity, names, birth dates, social security numbers.
We told you last week the documents were found in this public recycling dumpster in Springfield on Thanksgiving, no less. It is against HIPAA privacy regulations to dispose of them in this way. Now, we tracked the records to Community Mercy Health Partners, which operates Springfield Regional Medical Center. They told us in a statement they are still investigating the circumstances and will give all of those impacted free credit monitoring.
And tonight, Natalie Tyndall reveals this isn't the first time this health network has had problems with protected information.
Well, I found out that the same health network that is taking responsibility for this document dump, Community Mercy Health Partners, reported another problem to the federal government earlier this year. Community Mercy Health Partners is digging through hundreds of old laboratory reports that 2 News Investigates found in a Springfield dumpster last month. They have 60 days to notify patients involved, and if the number impacted goes over 500 people, they also have to notify the media and the U.S. Department of Health and Human Services. But 2 News Investigates found this isn't the first problem Community Mercy Health Partners has had with private information. According to the U.S. Department of Health and Human Services website, the network reported a different breach in April of this year. The report says an individual was accidentally sent the invoices of numerous patients due to human error. The breach involved demographic, financial, and clinical information of nearly 2,000 patients. The report says Community Mercy Health Partners retrained staff and revised processes so the accident wouldn't happen again. The health network says that breach did not involve social security numbers like the documents found in the dumpster. But 2 News Investigates wanted to know how common multiple violations are for a health network and what exactly is required under HIPAA. Deborah McDonald is Cedarville University's Director of Medical Services. She says health organizations that deal with private information are required to follow HIPAA rules.
That covers anything in the healthcare record, whether it's in written form, whether it's in audible form, or whether it's in electronic form. Those are all covered by HIPAA, and we are required to keep that confidential and protected.
She says when a health organization is getting rid of patient documents, they can't just be thrown in the trash. In most cases, they're shredded.
It's confidential, it's private, and so it's not fair to that patient to have their information available, because if you put it in a dumpster, for example, anybody can come and take a peek at that and look and see what's in there.
HIPAA trainers at the Supremacist Group say small HIPAA violations occur all the time in most organizations, but the big ones are rare. They say HHS can sometimes negotiate corrective action on those smaller breaches, but the bigger ones can carry hefty fines, up to thousands of dollars. The trainers say if an organization has a pattern of violations, HHS typically investigates further. They look at all circumstances before deciding whether to issue a fine. Now, HHS does not comment on potential or ongoing investigations, but they do post the results of their investigations after they're complete and will, of course, be monitoring their site for that.
And speaking of complete, your complete investigation, your initial investigation, you can watch that right now on our website, WDTN.com.
Absolutely.
Natalie Tyndall, 2 News Investigates.
Yep.
Thank you.
It's an eye-opener. All right, thanks, Natalie.